Hello, and welcome to our October episode of the Cancer Prevention and Wellness Series produced by the Cancer Survivors Park Alliance. I'm your host today, Julia Humphreys with Gibbs Cancer Center at Spartanburg Regional Healthcare System. Each month, we explore a different cancer-related topic, focusing on prevention, screening, and lifestyle choices that empower patients, survivors, and caregivers to live their healthiest lives. Today's conversation is a good one. It is all about sleep for cancer survivors, how improving sleep can enhance recovery and overall quality of life. I am joined by an esteemed colleague of mine today, Dr. Amy Curtis, Medical Director of Gibbs Cancer Center and Research Institute. Dr. Curtis is a radiation oncologist, clinical researcher, and the principal investigator for the Upstate Carolina NCORP, which is National Cancer Institute Community Oncology Research Program. She champions access to groundbreaking clinical trials with a special focus on researching underserved communities. Dr. Curtis is deeply committing to building trust in our healthcare system. She believes in creating meaningful connections with patients by providing exceptional care, fostering accessibility, and advancing the boundaries of medical science. Her dedication has earned her national recognition, including multiple awards for her success in enrolling patients in clinical trials. Beyond local research, Dr. Curtis serves on leadership teams for national cancer studies, including the TMIS trial, and contributes to improving care for advanced head and neck cancers. A graduate of UNC Chapel Hill, she completed training at Baylor College of Medicine and Duke University. Dr. Curtis is passionate about empowering her community with health solutions that inspire confidence and hope. And I can absolutely attest to that bio there. Wonderful to have you here today, Dr. Curtis. Thank you so much for being with us. And we are really looking forward to hearing your insights on this important topic. So take it away.
Wonderful. Thank you so much, Julia. And for everybody joining us, thank you for tuning in to hear more about this important topic, all about sleep. As we prepared for this meeting, Julia and I had some great conversations about not putting you to sleep while you're hearing this talk. So we hope it'll be interesting and engaging. Julia Humphreys has been a wonderful colleague of mine here at the Gibbs Cancer Center, and she really advocates for cancer survivors, making sure that their needs are considered at every step of the cancer care journey. So I'm really excited to have this conversation with you today, Julia.
I'm excited as well.
So I have some fun graphics in my slides and some great animations of people sleeping. But in general, our goal is that for cancer survivors, we want sleep to enhance quality of life and recovery from all of the toxicities of cancer treatment. So it's a pretty basic goal, but there are some complex biologic underpinnings to achieve this goal. So we all have had a bad night's sleep and know how bad it makes us feel. But for cancer survivors, these can lead to significant long-term outcomes that are problematic. So 50% of cancer survivors report persistent problems years after treatment completion, and 40% report sleep issues more than 5 years after completion. So this is a problem not just for immediate cancer survivors, but even folks that have gone through cancer treatment years or even decades ago. And sleep issues can encompass everything about sleep. So it can mean difficulty falling asleep, so tossing and turning before you finally get to a restful night's sleep. It can mean difficulty staying asleep, so having interruptions during the night for problems with urination, hot flashes, worry, pain, shortness of breath, dry mouth, any number of symptoms that cause patients to wake up and have interrupted sleep. And then there can be difficulties experiencing a restorative sleep quality. So patients that have that go to bed but and have a normal sleep time, but when they wake up, they don't feel well rested, and that's also a problem. So sleep is not just a number of hours with your eyes closed, it's having good quality of sleep. So why this matters is that there's a significant mental health impact. So poor sleep worsens depression, anxiety, and cognitive function. So folks feel more foggy when they haven't slept well. And of course, depression and anxiety are already difficulties for many cancer survivors. So poor sleep definitely worsens that. And then there are physical consequences. So sleep disruption is linked to increased fatigue, increased pain sensitivity, hormonal imbalances. And even outside of the cancer world, we know that poor sleep is a risk factor for cardiovascular events like heart attacks and strokes. So we know that sleep matters a lot, a lot. We spend about a third of our lives in sleep, and we want it to be good quality sleep.
I will say, Dr. Curtis, within clinic, I think this is the number one thing that I hear about personally from patients is having that difficulty sleeping, saying, well, I got 8 hours of sleep, but I really don't feel like I slept at all. So I do think that that mind-body connection of the mental health impact and also that physical component is really important. So I'm glad we're diving into that.
Absolutely. And I think that um, setting expectations for what recovery looks like is part of a good clinician is making sure that there's not understanding that there's not a magic pill or a magic treatment where you're going to go to sleep tonight and tomorrow you're going to wake up feeling well rested. Because everything is connected. So mental health and physical health affect sleep, and they also can affect all of the things that sleep can affect. So kind of a whole person approach, and sleep is an important part of that approach, but also all of the other things that you do in Survivor Clinic to address mental and physical health. So I thought I'd dive a little bit more into the cycle of sleep and psychological distress. So many of our cancer survivors start with the fear and anxiety. And sorry, are you all getting a pop-up? Yep, I'm gonna unplug this, my microphone that I use to dictate. So there's fear and anxiety. So patients that fear recurrence, they have can have some intrusive thoughts about mortality and I'll just call them existential concerns. But they can create heightened emotional distress that can interfere with sleep initiation and maintenance. So once you're there in that fear and anxiety state, it is hard to fall asleep. And so there's difficulty falling asleep. There can be frequent awakenings and non-restful sleep patterns. This often worsens during periods of increased stress or medical appointments. So then you have this cycle where you're worried, including maybe worried about sleep. Then your sleep is disrupted. And then the consequences of that are that there is impaired cognition and emotional regulation. So you're just not as resilient after a poor night's sleep, and that can compound. And so you're not as resilient, so you can feel those fears and anxiety more acutely, which then can lead to more sleep disruption, which then can lead to worse resilience and increased fear and anxiety. So this cycle really can be quite vicious.
Yeah, absolutely. I think an important part of that is when you're talking about the negative adaptation is once you get to the place of not having enough sleep or adequate sleep for your body, especially in a healing phase for yourself, it is that you may want to be making certain decisions that are very important during your cancer treatment or in general, and you're just not able to process the way that you would normally process. I think everything is shortened, your attention span is shortened, your cognitive processes are just so slowed down or foggy, is what I always kind of relate that to, of kind of walking through a fog. But like you say, it will just keep on repeating itself. It's a vicious cycle for sure.
Yeah, and I will say that as a clinician, as a doctor, I often put people into sleep disruption. So when I prescribe steroids or when I prescribe treatments that can interrupt sleep, so if a patient's getting up multiple times a night to go to the bathroom because of a side effect of my treatment, well, I've put them there at that start of the cycle. And then maybe the next day they're not feeling as resilient. And then they have some worries, and then that can kind of make everything worse. And so earlier I started the cycle with fear and anxiety, and that kind of puts it on the patient, but that's not right because really we can put it on cancer treatments as causing sleep disruption, which then can lead to the vicious cycle. It doesn't always start with fear and anxiety. The fear and anxiety can actually just be a consequence of having poor sleep. Like, that it you feel worse and you have more worries when you haven't had a good night's sleep.
That's a great point. Yes.
Um, so how do we interrupt that cycle? So that's the point, as we all know that things can kind of take a turn for the worse, and then it's hard to stop it. But we have some great tools to stop that vicious cycle. And the first is the basics. So sleep hygiene. And I feel like people have heard it, but it's always important to go back to square one, especially if you're not having a good night's sleep. It can be hard to remember the basics. So, the first is a consistent schedule. So, maintaining a regular bedtime and wake time, even on weekends, will help regulate your body's internal clock. And that is so important. Again, going back to what we as clinicians do, if you've spent a day in the infusion chair and you've gotten some medicine that might make you sleepy and you've kind of dozed during the day, well, then you might go home and have some trouble falling asleep, but you get to sleep late. And so then you decide to sleep in the next morning. And it's not too hard to get your days and nights kind of mixed up or have them blend together. And so, one of the first steps is enforcing a consistent schedule. And it can be hard if you haven't had a good night's sleep to get up when your alarm goes off. But it's important to do that because that will create the drive to have a good night's sleep the next night. So to have good sleep, sometimes you do have to sacrifice a little for, a few nights or a week until you reset your schedule. But it is really, really important to have a consistent schedule. And sometimes that means you have to get out of bed when your alarm clock goes off in the morning. And as a cancer survivor, as a cancer patient, that can be really hard because I do like to say, listen to your body. But when it comes to sleep, I'm going to say, listen to your alarm clock in the morning and get out of bed. The other part of this consistent schedule and maintaining your body's internal clock is we're going to talk a little bit about making your nights night, but you need to make your day day. Okay. So if you are sitting in a kind of dark or dim room during the day and you're watching TV, like it's not really that different than at night if you're sitting in kind of a dim room watching TV. So when you wake up, get some fresh air, get some sunlight, listen to the leaves rustling through the trees. That's going to be really, really important for having good sleep schedules and enhanced alertness during the day. The other thing that can be helpful is some physical activity. So, taking some walks, again, outside is better than inside just to get that day going. The second is the optimal environment at night. So, creating a relaxing, dark, cool environment. And temperature is really important. Studies have shown that between 68 and 70 degrees is the optimal temperature for sleep. Everybody's a little bit different, but I would nudge patients towards a cooler environment rather than a warmer environment for good sleep. Of course, in the evening, avoid caffeine, heavy meals, vigorous exercise. You definitely do not want to be mainlining a Red Bull right before you go to sleep. That would not promote a healthy balance. And of course, while I said vigorous exercise close to bedtime, you don't want, but you do want exercise during the day. That can help. You can kind of work up a drive to sleep by having a good night's a good active day. And then worry management. So scheduling a dedicated worry time earlier in the day. Again, maybe while you're on a walk, you're going to say, I'm just going to take this walk and get all my concerns, let them float through my head, and understand that they're there. And then have that time at night where you've already had your worries.
I will chime in on that and say, just from a personal note, this has been something that I've really tried to focus on in the past few months, and it does make a really big difference. Like you're saying, the worry management, I will write down a to-do list for the next day when I get into bed. And so that way it's all down on paper. And so when I actually go to shut my eyes and rest, I'm not constantly rolling through all of that for hours at a time. And the other thing that you're talking about in terms of getting fresh air, I've really made that a commitment, and I think that that's something that's really important. Of even if you don't want to step outside, with us getting into the cooler months now, just opening a window even in the room that you're getting ready in, and just kind of having that fresh air kind of circulate through the room. I'm curious about your thought of social media and how that plays in regards to people's sleep. Now, I know everyone's phones are
Oh,
usually very close by, and so in the
yeah.
mornings, you may grab that with your coffee instead of reading a book, or at night, that may be the way that you're kind of, you think that's the way that you are keying things down for the evening, but what does that actually do for your health?
Yeah, that's a great point. I definitely, so any kind of screens before bedtime are bad. The blue light can affect your pituitary, which can affect your secretion of normal hormones to go to sleep. It's really hard. I mean, a lot of people have screens in their bedroom, tablets, TVs, cell phones. But as much as possible, if you're able to take out a paper magazine, look through and read, whether it's Popular Science or Better Homes and Gardens, but just something that you can look at that's analog instead of digital can help. Listening to music can help as well. I also want to go back just a minute and talk about worry. I think a lot of cancer survivors get the message that they shouldn't worry, and then there can be some mixed emotions about that, like guilt and I should be grateful, I shouldn't be worried, or I've had a good scan, so I shouldn't be worried. Um, or I shouldn't worry because I can't do anything about it. And um, those messages, I mean, they're out there, and lots of patients endorse some of those messages. But I like to tell patients that the worry can be protective because it makes you pay attention to your body. And so I tell patients that you can kind of thank your worry. Like I hear you that you're worried about a recurrence and I'm going to take steps to be healthy. Or I hear you that you're worried about these symptoms. And so I'm going to make a plan to call my doctor. And I think knowing that worry that leads to being a self advocate and paying attention to your body's signals that something may be going on is healthy and protective. I do not want patients to go out into the world and have not a care in the world and miss that they're coughing up blood or that they have a new mass that really needs attention. So, with everything, there's a balance, but for some patients, just kind of thanking the worry and say, like, I know you're worried, and that's right, because cancer is a big diagnosis and needs to be taken seriously. And now that I've acknowledged that worry, I'm going to get on with my walk. I'm going to get on with cooking my lunch. I'm going to get on with um, running my errands or doing my job at work and being present and purposeful in my daily activities. But I don't think not worrying is a healthy option either. I think having some degree of protective worry is appropriate. So sometimes just thanking your worry can be helpful.
Yeah, I think I've always kind of thought of it as like once the worry hits you to let it flow through you instead of trying to stop it, because if you stop it, it's going to stay right with you. It's not going to go anywhere. It's not going to be processed. And so let it move through, like you're saying, thank it, acknowledge it, and then it can be released. And it may resurface, but you're not going to hold it.
Exactly,
Mhm.
exactly. So with that worry management, I think some of those, like you said, letting it flow through rather than stopping it, and again having some scheduled time where you can acknowledge those worries and act on them as appropriate. So if there is a health concern, or you're worried about somebody else in your life and you want to schedule a time to reach out to them with a phone call or a text, let them know that you're thinking about them. I know a lot of cancer patients have worries about themselves, but they also worry about other people, which is, really it can make it hard that people are being cared for, but also caring for others. So I'll talk about some other practical tips that can help. So there are some mindfulness techniques for restful night's sleep, and again, thinking about cutting off that vicious cycle where there's some anxiety and increased wakefulness. Um, so cognitive behavioral therapy is one option, and it can even be done online. So there's not enough in-person therapists for all the people that have insomnia and would benefit from cognitive behavioral therapy. Folks can just Google cognitive behavioral therapy for insomnia, and there are many online modules. Actually, the VA Medical Center has a great one. And one of the techniques that it says is kind of reframing and giving your mind something else to think about. Julia, as you said, it's not really helpful to say, don't think about your worries. It's much better to give your brain something else to think about.
Right.
Um, and the key is to think about things that are kind of calming, but not, but provide enough mental stimulation to rise to the top of your mental load. So some people in the past talked about like counting sheep, but for most people that doesn't rise to the top of the mental load, and so they can still worry and count sheep. You need something a little bit more. At the same time, if you're like planning to refinish your backyard, that's probably too much cognitive load, and you need something a little milder. And these are a couple techniques. One is kind of an alphabetical diversion. And so you can pick a category and start at the beginning of the alphabet and then move forward. Some people use cities. So, Athens, Atlanta, Asheville, Aiken, Abbeville. Now, that wouldn't be great if you were a traveling salesman because you might think of all of your clients you have in all of those cities. If you've got particular worries about, geography, that wouldn't be good. Some people use fruit, so apple, apricot, banana, coconut. And if you can't think of something, you just skip it. Again, you're trying to fall asleep. There's not a quiz at the end, so just kind of going through one by one. My favorite is dinosaurs. I have children, and when they were little, we read so many dinosaur books, so many dinosaur books. I know hundreds of dinosaurs, and so when I have trouble falling asleep, sometimes I'll just start with, Apatosaurus and Archaeopteryx, and then Baryonyx and Brachiosaurus, and I just think of the dinosaurs, and that kind of brings back some like warm associations for me and my family, and can kind of help my mind slow down. The other one that can be used is a sensory immersion. So a task like making something or planting something can be really useful. And again, I'll just give an example from my personal life. So I have a long-standing family recipe for spaghetti, and and make it. It's homemade, and you start by chopping the onions and then browning the meat. And so there's a lot of things you can focus on, and not just like what are the steps in the recipe, but what does the knife feel like in your hand when you're slicing it through the onion? And then what does the onion sound like when it hits the pan? And what does the wooden spoon feel like? And you almost want to be making a documentary. So if it takes 30 minutes to make the spaghetti, Like you really should be spending 30 minutes in your mind thinking about how you're making the spaghetti. And you'll probably fall asleep, in the first 5 to 7 minutes. I do want to say that normal sleep latency is up to 20 minutes. So if you're taking 10 or 15 minutes to fall asleep, that's normal. Like it's not, there are some people, of course, that as soon as their head hits the pillow, they're out like a light. But normal is up to 20 minutes. And so I wouldn't, your mind is just shutting down. That's just part of it. And these exercises can help. Another sensory immersion is taking a walk through, again, a familiar or comforting place. So if you have a family relative that you always loved visiting their house and you think about like what their steps look like and what their front door looks like. Do they have, a door knocker or a wreath? You think about, their door handle or their screen door, and then you walk in and what's the room you see when you walk in, and then what are the objects in that room, and then do you walk into the kitchen from there? So that kind of sensory immersion can also help, and just really, really trying to think about everything, the smells, what you see, what you hear, is there something cooking in the kitchen? Do they have music on in the background or some wind chimes? Really, really trying to focus on engaging your mind and thinking about things that can help with falling asleep. And those are some cognitive behavioral therapy techniques.
Those are really wonderful. I love the thought of both of those. I would love to hear how many dinosaurs you can name too, by the way.
Yeah.
That's a hidden talent I did not know about.
Yes.
I will say, I learned this from a yoga instructor a while back, and it's been really helpful for me. And as we say, when we're talking about personal, I'm only doing this to help relate with people. You
Right.
take things to your own discretion, of course, but it is going through each part of your body when you lay down and saying, gosh, how does my head feel today? Like, oh, it feels a little tight. I've had a hard day. Thank you for being able to get me through the day. And then you move down. How do my shoulders feel? And I'll go through everything. Or does my skin feel dry? Do my muscles ache? Am I feeling rested? And you just go through each part of your body all the way down to your toes. And I will tell you, I do this very often and I never make it to my toes. So
Yeah.
it is a way that just kind of brings you down and like connects yourself with your body. So another thing that you could possibly try.
Yeah, that's fantastic. And I love that all of these are somewhat systematic. So your mind has a plan that it's going to follow. We're not saying like relax, you know, relax and fall asleep. Like helping your mind turn to sleep is important. You need a plan.
Yeah, I think that's very like comforting for your mind in general to know what's coming, right? So when you kind of know how that story is going to play out, just like your recipe, or know how when you're going to that location in your mind, you know the ending of that. And so it's very calming for your brain to be able to go ahead and be able to interpret that. I feel like that's calming in itself to help you rest.
Yeah,
Yeah.
absolutely. So unfortunately, there are some barriers. So we've kind of talked about like the baseline, that sleep problems are common, and there are some techniques, the sleep hygiene and some cognitive behavioral therapy. But of course, sometimes it's not as straightforward as that. So there can be some physical limitations. So treatment-related side effects, neuropathy, chronic pain, hormonal changes, medication interactions. And it's very important for survivors to talk to their care team about that because there are oftentimes treatments that can help with that. And they we can make some modifications as needed. So having a conversation with your doctors, your nurse practitioners, your PAs about the physical limitations that are preventing you from sleep are really, really important. And then there can be some access barriers. So I mentioned that the cognitive behavioral therapy for insomnia, that it can be hard to do in person because of time constraints, travel difficulties, the availability of therapists. But fortunately, that one has less access barriers since cognitive behavioral therapy online has been demonstrated in well done randomized controlled trials to be effective for insomnia. And so anyone with an internet connection can access that. But then there are some scalability needs. So again, the growing population of cancer survivors, you need to have a scalable and cost-effective interventions. And so I think education modules like this are part of that, being able to scale it out to anyone who's able to watch a YouTube video and participate with the Cancer Survivor Series is going to be able to access that. So really appreciate the Survivors Park for hosting this and helping us scale some of these interventions. I also want to spotlight that, you know, this isn't static. Our state of understanding insomnia for cancer survivors is still evolving. At Gibbs Cancer Center, we partnered with the University of Rochester up in New York to do a study looking at yoga. So Julia already mentioned that, and cognitive behavioral therapy, as well as usual care, which is telling patients about sleep hygiene. And both the intervention arms, the yoga and the cognitive behavioral therapy, improved outcomes for cancer survivors. So improved alertness during the day and restful sleep at night. So it was a really successful study. And we learned a lot about our survivors' adaptability and implementation. The study also collected blood specimens from participants. And so there's some really interesting basic science research that's going on about markers of inflammation and circadian clock distance, all of these biologic markers that change as patients go through an intervention like yoga. You can see those inflammatory markers coming down and their sleep quality improving. So there's some great science that's going on there now too, and that's something that our cancer center is really dedicated to, is science, not just for improving treatments, but improving outcomes for cancer survivors for quality of life. So Julia, I think you'll have some comments here about, integrating sleep care into survivorship programs and kind of best practices. But, what I've seen often is, routine screening. So making sure that clinicians are asking about sleep, and then having some interventions that can be delivered with relative ease. That's really important. A lot of times patients are tapped out. And then having some good education and empowerment for our survivors.
Yeah, I will say right now, actually, it's coming to mind because we're currently embedded in providing this series here. It's called an Empower Hour for our survivorship patients. And right now, the series is focused on mindfulness and meditation, and sleep keeps coming up every week during the series and how they can incorporate those CBT therapies and interventions for that. And so I've just found it very interesting. We're going on our fourth week this week, but every single week, sleep has come up for
Mhm.
the survivor population. And they do, like you said, like get some rest, like try and get some rest is what they hear a lot, like, oh, we're just trying to get in bed earlier, and having those actual skills of ways to calm your body down or ways to redirect your brain, and is what they're learning through the CBT therapies. And I think that is really, really important and eye-opening to see, once people actually are given the tools, how they're able to implement those week to week.
Yeah, that's fantastic. Um, so in conclusion, we want to prioritize sleep and empower survivors. It's critical to recognize that sleep is vital and often overlooked as a part of comprehensive cancer recovery. So I would encourage patients to be their own self-advocate and again, report symptoms and problem sleeping. We have evidence-based solutions. We have this dedicated yogas program. There is cognitive behavioral therapy, relaxation techniques, but we need more. And we also need more evidence-based solutions for prevention of insomnia. It would, as great as treatment is, it would be even better if patients didn't even have to experience it before getting help. And then just making sure that all of this works together to have a comprehensive impact to advance mental health, physical wellness, and long-term outcomes. So I'd like to invite our online audience to ask me any questions by email. And there is my email address. So acurtis@gibbscc.org. And I love this picture. It just looks like this person is laying there and so well rested with the sun coming in and just ready to open their eyes and start the day. And that's my wish for all of our cancer survivors is that they'll have a restful and wonderful night's sleep and be able to have a purposeful and fulfilling next day.
That's wonderful. Thank you so much. I love how she already looks like she's just ready to get up and go for the day too. If I woke up and my hair looked like that, it
Yeah.
would be amazing, right? So
Well, this is the power of AI. So you type
right.
in a little prompt about, restful night's sleep and ta-da.
I love it. Thank you so much. I feel like this was really informative, even for me. It's things that you don't have to be a cancer survivor. I think it's very helpful for cancer survivors, but you can be a caregiver. You can just be someone that's a friend of someone with cancer. I think all of us deal with sleep in terms of needing more of it, feeling like we're not getting enough. So I really appreciate you joining this today for this topic. And your insights are just, they're obviously wonderful. So we appreciate it coming from you. Thank you so much.
Yeah, thank you, Julia. All
Yeah,
right, everybody, have a great day out there.
thank you. All right, everyone. So we really, like I said, appreciate your time being here with us today. We appreciate everything that comes from your day to be able to stop and pause and learn a little something new with us. This wraps up today's episode of Cancer Prevention and Wellness. This is also produced by the Cancer Survivors Park Alliance as a reminder. I want to leave you with a quote and just let you know what's coming up in November. So our quote today is going to be in alignment with sleep. We're going to go with your future depends on your dreams. So go to sleep. Sleep is the best meditation. It restores our energy, heals our bodies, and clears our minds. In rest, we find the strength to rise again. That is from the Dalai Lama. We do hope that you will come back and join us in November. The next Prevention and Wellness series will be presented by Molly Slay. It's a lymphedema occupational therapist. She will chat with us about the importance of breast cancer rehabilitation. We hope that today's discussion has really offered helpful insight into how sleep quality can support healing and overall well-being for all. To learn more about any of these upcoming events, educational programs, or community resources, please visit cancersurvivorspark.org. Thank you so much for listening today, and we hope you'll join us again next month as we continue to explore ways to live well. Thank you. Bye-bye.